Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Auni Afifah binti Zulkifli. I will present about the treatment planning comparison of Impt, Vmat and 4-pyridotherapy for prostate cancer. So this is my overview of the slide. Firstly, I will talk about the introduction of Impt, Vmat and 4-pyridotherapy technique. Next is the strength and weakness of the paper, and next is the best choice for the prostate cancer treatment planning, and also references. So let's start with the introduction of this paper. So actually the current problem is there is a substantial risk of gastrointestinal toxicity which is rectum dose in the current EBRT technique. So the objective of this paper is to reduce the possible toxicity in order to achieve the better conforming radiation dose to the prostate by implementing the new technique of radiotherapy. So there are three types of new radiotherapy technique, which is Impt, volumetric modulated arc therapy, and 4-pi radiotherapy. Okay, actually what is the Impt, Vmat and 4-pi? Impt have a unique characteristic which is bright peak, which allow the extremely localized dose delivery at a precise depth with no existence, while for the Vmat is a type of photon therapy technique which deliver efficiency at equivalent dosimetry, and 4-pi radiotherapy is a non-coplanar IMRT technique which has superior organ at risk dose sparing in a various tumor site. The strength of this paper is all the symmetric analysis focused on the CTB, since the Impt have no PTV, and for the three technique use same patient and same dose, which is 79.2. The weakness of this paper is this paper using a small sample size, which is 10 prostate patient. So this is the three treatment planning, which is Impt, Vmat and 4-pi. This is the method how the planning was done. So based on the isodose and DVH, we can see that the lateral beam angle of Impt plan delivered a greater dose to the femoral head than the photon plan. But in 4-pyridotherapy, the femoral head dose are significantly lower than those in Vmat, and Impt result more homogeneous CTV coverage and at the same time reduce the hotspot which visible in the 4-pi and Vmat dose. Based on the figure 3, 4 and 5, we can see that the lowest Impt mean dose of the bladder and sigmoid colon and the maximum dose for the bladder, rectum and anterior rectal wall, while lowest 4-pi radiotherapy mean dose for the anterior rectal wall and the femoral head, and the lowest maximum dose for the femoral head. Vmat also has the lowest volume 70 and volume 75 for the bladder. 4-pi radiotherapy achieved the lowest dose volume for all the rectum metric except for volume 18. Impt is superior in almost all of the CTV dose metric, showing more homogeneous dose distribution in the CTV. Impt has least intermediate and low dose pillage, R50 and R10, and also integral dose. So as a conclusion, the best choice for the prostate cancer treatment planning is the Impt, which is Impt is the unique physical property of the heavy charged particle that will deliver the majority of dose in the sharp bright peak and leave no existence. And Impt also achieve the similar dose sparing overall compared to the photon treatment method, with the exception of the high dose of to the femoral head due to the proton entrance dose. Besides that, Impt is clearly better in PTV dose homogeneity and coverage. It also reduce the maximal dose to the bladder, rectum and anterior rectal wall. It is also excellent in reducing the maximal point dose to surrounding normal organs and reducing the low dose pillage, and also achieving a more homogeneous target dose. So this is my references. Thank you.